Hello, my name is Lauren Rubin, and my dental health promotion is decreasing oral cancer risk through increasing tobacco cessation. The focus here is oral cancer up in smoke. Hello, my name is Lauren Rubin. Healthy People 2020 has identified the oral health of patients who use tobacco as having major risk factors for oral cancer, and that these patients could benefit from intervention and tobacco cessation resources that are provided to them by a dentist or dental hygienist during their routine care and follow-up visits. Oral Hygiene Initiative 14.1 has identified the need to increase the proportion of the 13.2% of patients who use tobacco that receive information focusing on reducing tobacco use over the course of a year. Healthy 10.5% of adults have received information from a dentist or dental hygienist focusing on reducing tobacco use over the past year. Tobacco use is known to be a risk factor for cancer, but has numerous other health and oral health concerns such as stained teeth, gum disease, bad breath, slow healing, systemic disease, inflammation, dulled sense of taste, and many others. It is important that the dental health care professional is educated on effective tobacco cessation skills so that the patient who uses tobacco may have an increased chance of quitting. Let's take a moment and watch a short video that identifies this problem. 10.5% of adults have received information from a dentist or dental hygienist focusing on reducing tobacco use over the past year. Tobacco use is known to be a risk factor for cancer, but has numerous other health and oral health concerns such as stained teeth, gum disease, bad breath, slow healing, systemic disease, inflammation, dulled sense of taste, and many others. It is important that the dental health care professional is educated on effective tobacco cessation skills so that the patient who uses tobacco may have an increased chance of quitting. Let's take a moment and watch a short video that identifies this problem. This oral health initiative is to increase the tobacco cessation resources provided throughout the year to the patients who use tobacco. These resources will be provided at the regular care visits and follow-up appointments. This is achievable by implementing an in-office hands-on workshop on tobacco cessation that's provided annually to the dental health care provider. The design of this program will be to assess the population of patients who use tobacco, to diagnose the problems of tobacco use, including the rising healthcare costs, to plan services that stress the importance of tobacco cessation, to implement hands-on workshop and training, and then evaluate the success of the program. This oral The program environment that I chose for this health prevention program will be best implemented into private practice or dental practices that would be able to get all members of the dental staff involved to keep the team aware and informed of the individual office goals of tobacco cessation. The benefit of this setting is that it affords the entire office the opportunity to help educate, motivate, support, and encourage patients on their journey to becoming tobacco-free. However, it's not without its barriers that may arise from scheduling errors, office non-compliance, and organization errors that would not be able to include every team member in the hands-on workshop training. Although there are many knowledgeable providers that can be used to implement this health prevention program, the program workforce would ideally be composed of subject matter experts. Subject matter experts are in the best position to provide the motivational interviewing and behavioral cessation tools to help us get the highest possible favorable outcome. These providers are numerous, but may consist of behavioral experts, addiction counselors, and even expert dental hygienists who have extensive experience working on tobacco cessation. The financial resources and funding of this health prevention program can come from existing funding, such as the CDC, the Quit Now program, or solicitation for funds can target insurance companies, including TRICARE and other federal sources, and even fundraising can be done at events such as the smoke out events, where people are motivated to quit smoking. These can also include lung cancer and tobacco-related charity events. The diagnosis and need is assessed based on the population of patients who use tobacco and the problems with the rising healthcare costs for both the patients and insurers, overall to reduce the burden of chronic diseases and to tackle health inequalities. Encouraging continued education and refreshing dental providers on tobacco cessation and motivational interviewing can be implemented and evaluated to reduce the incidence of disease. The objective is to increase the amount of services and tobacco cessation resources patients receive during their year at their regular visits and at their follow-up appointments. The best way to achieve this objective is by having an annual hands-on workshop and refresher for the dental staff. The outcome goals is to improve the dental hygienist's knowledge and behavior regarding oropharyngeal cancer and tobacco cessation, and also to increase the amount of patients who receive tobacco cessation, and to increase the successful attempts to quit. Indices that I felt would be beneficial for program measures and assessment is performance management evaluations and incidence rates. They will be used to measure the change to determine the program's effectiveness. These evaluations are easily conducted in a small practice setting, and they can also be documented annually. Performance management evaluation refers to the systematic process by which an organization involves the employees as individuals and members of a group on improving the program effectiveness in accomplishing its mission and goals. Oral cancer and tobacco usage is one example of a dental condition that can use rates for measuring the incidence. The rates of the incidence would refer to how many new cases are seen. So in short, how many patients do we have that use tobacco? The timeline will occur over an annual evaluation of success and setbacks that will be part of the hands-on workshop training and refresher course on tobacco cessation. The use of the epidemiological data and statistics in understanding this dental health research would include mixed methodology, which is both qualitative and quantitative. The first evaluation would be to determine the results of the program as having an impact on the influence of continuing education relating to behavioral changes of oral cancer screening and tobacco cessation. This research design would include descriptive surveys. This would gather the information about the status quo. These surveys would be obtained in the form of opinionaires and questionnaires that would be returned after the annual cycle of the program to evaluate its setbacks and successes. The second evaluation would be to determine the amount, numerically, in number of tobacco cessation services provided. This data is quantitative and would include the overall count compared to the overall count of patients who use tobacco. Due to the small scale of data available annually and the insufficient meaning to numerical analysis, this data will be analyzed by using a categorical variable. That means that it will be using a rating of excellent, fair, or poor. These are qualitative in nature. This method of analysis would offer inferential statistics. This can demonstrate the correlation of the data and its influence on results. The two ways that I would choose to display this data would be through the use of a histogram and scatter plot, which you can see here on this slide. The histogram would show the ordinal variables that are treated as continual data. The scatter plot would also be appropriate since the relationship between the two variables can be seen in a more organized manner. Here we would plot one variable that's constant on the x-axis and the other one on the y-axis so you can see the difference in the static variable and its influence on the variable that's able to be changed. Through analyzing and displaying this data and using our statistical decision making, we can come up with the null hypothesis of increasing tobacco cessation services to the patient who uses tobacco may ultimately not influence the dependent variable, which is the patient. We can also select our alternative hypothesis, which says increasing the amount of tobacco cessation services to the patient who uses tobacco may have an effect on the dependent variable, the patient.